This is a Hope 1032 podcast.
To She Wasn't Born Yesterday for women who are 40 plus fabulous by the Empty Nest Chicks. I'm Janet Evans, ex-M&T Saatchi advertising creative who have won numerous radio and TV awards. Not that that'll affect us because we're doing a podcast.
And I'm Dr. Amelia Haynes, who has been a medical doctor for 30 years and specialising in sexual health and mental health and relationships, and I'm generally a very useful human being.
Well, we'll find out about that, but we are here to work together.
People tell me on good authority that I am.
Really? Yes, well, they never say that to me, so I think we're the perfect hosts for She Wasn't Born Yesterday. Amelia, we're here to talk today about the 5 essential exercises for women over 40.
I think this is such a good idea.
It's such a provocative title too because, what are they? Whenever you read that sort of clickbaity kind of title, you instantly just want to know, okay, give them to me. I just need to know, what are those 5 essential exercises?
Exactly.
And why are they essential for me? So today we actually have an expert called Andrew Webster, and he is a specialist musculoskeletal. I had to pause while I said that to make sure it came out right. Physiotherapist.
I was going to say, just to critique you.
Yes.
In fact, saying musculoskeletal.
Oh, skeletal.
Yeah, would
man, I
actually
didn't.
be even better.
Yes, great. Okay, well, we'll take 2 on that. No, we won't. But he's with a company called Body Balance Physiotherapy. Andrew, we are very, very excited to have you on our show today.
Thank you very much for inviting me. Lovely to be here.
Now, your website says that you deal with elite and sub-elite sports injuries right through to complex musculoskeletal presentations involving the spine and peripheral joints. So that sounds very impressive, but what do you actually do?
Well, I guess I've been a physio for coming up 40 years now, and my main area of work is obviously musculoskeletal injuries. So that involves people who garden variety injuries like hurting your back or hurting your shoulder, people, weekend warriors doing gardening or cleaning cars or falling over or doing things like that.
Putting up Christmas lights, yeah.
Yes.
Falling off ladders and things like that, up to people who injure themselves pursuing recreational pursuits or sports pursuits. So those people can be recreational athletes, they could be semi-professional athletes, occasionally they could be professional athletes. My area probably sees now less professional athletes. They probably more stream to sports physiotherapy clinics, such as Amelia works in.
That's right. I have to say there's a conflict of interest here because I do know Andrew.
Oh,
and the reason he's on the show is he's magnificent. He is magnificent. And in fact, you're hiding your light under a bushel slightly because he is now a consultant of physiotherapists too. So it means he's the elite of the elite.
Oh, you're the go-to.
Yeah.
Wow.
He's very competent. Awesome. That's what it means.
Thank you very much. It's nice to get that feedback.
And she'll slip the check in the mail later. It is a provocative title, the 5 essential exercises for women who are 40 plus fabulous. So let's cut to the chase and ask, what are these 5 essential exercises?
Yeah, so probably one of the good things to do to break this down before we actually go into exercises was go into some of the principles of exercise, because I think that's important. Exercise is many different types of exercises and exercises for different sorts of things that you want to achieve. But I thought it was pretty good to actually have an overall plan of what the principles of exercise are. So my first principle of exercise, and I'm often saying this to patients when I'm consulting, is find an exercise that you like. I think that's probably my first take-home message, and I think that's probably the most important thing, because people, if they feel like exercise is a chore or something that they don't enjoy, they're not going to continue with it. So I think that's the first crucial principle. Second one would be find an exercise that you can fit into your schedule. And so that might be a schedule that involves busy work life, a busy work-family balance. You might be a family that owns a family pet. So one of the things I suggest is try to incorporate exercise with your family pet. So whether that's walking, running, or exercising down at the park. And that's certainly something that I do. So I've got a dog, so I incorporate my exercise with my dog. My third principle would be to vary your exercise. Don't get stuck on doing the same thing all the time. So you need a bit of variation. That's not only good for your compliance with exercise, but it's also really good for being able to achieve different things with exercise. Fourth principle is determine what you want to get out of the exercise. So as I say, various exercises will help you achieve various things. So know what you want to get out of the exercise.
What sort of things are you thinking, Andrew? Like what sort of things? Yeah.
If your balance is not very good and you feel like your balance is a problem, then you can lean your exercise to doing more balance and coordination work. If you feel like your strength and maybe your upper body strength is not good, then you can tilt your exercise to including a little bit more upper body strength. Bone density, if that's an issue, then you'd be looking at exercises that are going to preferentially help bone density issues. So it's good to have an understanding of what you want out of it. Some people just want to be generally fit, cardiovascular fitness and general strength, and that's good. That allows you to have a rounded exercise routine. But there might be people with particular health conditions or health issues that they've got to address that need to do particular exercises preferentially to actually really positively affect that sort of problem that they're presenting with. And then probably my last principle would be decide what medium you want to exercise in. Do you want to exercise in a gym? Do you want to exercise outside? Do you want to exercise in a pool? And that sort of probably comes in to the first principle of find an exercise you like. But there are different mediums that you can exercise in, so it's probably good to choose what you want to do from that. Those are probably my 5 principles of exercise.
Yes.
On the back of all that, for anybody who's probably over 40 and starting up exercise newly or starting to do a new form of more intense exercise, they probably need to see somebody like Amelia's profession, and make sure that they've got all their systems checked and make sure that their general health is good.
Yes. It would definitely be preferable to seeing someone like me who could consult them about their advertising, but that would be about it.
Their brand, their personal brand.
Their personal brand, yes. What workout gear are you going to wear? What active wear? What brand?
That's very important.
Well, exactly. It makes you feel good.
Most important for over 40 plus women, isn't it?
Yeah.
Well, actually, I was going to say, Andrew, as I say, knows me of old, and I'm seriously not driven to do exercise ever. And the way that, like the equipment, like in the clothing, is very important to me. So I think, that's
active
part
wear.
of it. Yes.
I think you need to feel good about yourself while you're exercising. Yeah. It's a positive reinforcement. Was that part of your 5 essential exercises? Choosing the right active wear?
I'll work it into it is now, Janet.
As 40 plus fabulous women, what happens to our bodies? Like, why would we need different exercises, say, compared to when we're 20 plus fabulous?
Okay, so I guess the other topic that I thought that I should mention and talk about, a common topic that I talk to patients, middle-aged female patients about, is menopause. I'm obviously not an expert in menopause. You're asking a middle-aged white male about things like that. I do know a little bit about menopause, but certainly the details of the nitty-gritty can be filled in by somebody with much more experience than me. But I guess menopause brings with it a number of issues, vasomotor issues, muscle and bone issues, urogenital issues, psychological issues, skin changes. So there's a whole lot of gamut of changes that happen. But certainly it's something to consider and something to think about and something to prepare for as well. So part of the preparation for menopause would be your normal medical checks and particularly your bone density check, which is a topic that I'm often talking to female patients about, particularly female patients, but also male patients, because it's osteoporosis and bone density problems is an issue that can happen in males as well as females, but more common in females.
Andrew, going in for a DEXA scan would actually be quite a good idea for a lot of people, because then not only would their bone density be checked, but they could see how much of themselves was actually fat versus muscle, etc. Yeah.
Is that right? What is it? A DEXA?
DEXA.
DEXA.
Honestly,
Okay.
you should do it. DEXA.
I've written that down, yes. What does bone density have to do with exercising?
So bone density is something that gets negatively affected with, or can get negatively affected with menopause. So estrogen is one of the hormones that allows your body to lay down mineral content in the bone. And if there's a mismatch in how much mineral content is reabsorbed by your body compared to how much is laid down, then you get an imbalance in that and your bone gets weaker. So you end up with a bone that it demineralizes, and there's varying levels of osteoporosis. The first stage is a stage called osteopenia. There's varying levels of osteopenia. When it gets to a more critical stage, they classify it as osteoporosis. When you get into the osteoporotic stage, people have a much higher risk of low energy fractures, bone fractures. So it's something that is more common in females and more common in perimenopausal or postmenopausal females. So it's something that I'm often talking to my patients about trying to incorporate some exercise to actually encourage what we call impact exercise, things where you're loading your body, where you're weight bearing, where you might be putting some sort of impulse through your body to actually allow your body to respond and your bones to respond, to actually become a little bit stronger, lay down a bit more mineral content, and therefore hopefully correct the imbalance of the bone density issue.
So if you've got osteoporosis and low bone density, can exercise actually top it up or increase
it?
It
Can help a lot.
Okay. Yeah, cool.
Yes, it can. And again, Amelia can probably talk to that a bit more than me, but certainly various studies 25 years ago showed that with a good management which involved weight-bearing exercise, sufficient vitamin D, sufficient calcium intake, and sometimes looking at hormone replacement therapy, that it could positively affect bone density and actually take people from an osteoporotic range up into a more normal range. So it was thought for many years that osteoporosis was something that once you had it, you couldn't do anything about.
Right.
But that's actually been shown to be incorrect.
Well, that's very encouraging.
It's more dynamic.
Yeah, right. And so what are some examples of these exercises that we could be doing when we're
Tell us the
50 plus
really,
fabulous?
Exactly. The ones that are really helpful. The
must-haves.
Yeah.
For bone density issues, probably the basic exercises would be things like walking at different cadences, different speeds, up and down hills, up and down stairs. Change your pace and change the load that you put on yourself. You can make it more cardiovascular effort as well as weight bearing. The other basic exercise would be something like jogging.
Oh.
So jogging is a fairly normal type of exercise, open to anybody that has a pair of shoes and the intent to do that. And it's a very convenient exercise, and probably one of the ones that is very helpful for bone density issues because you're getting a lot of impact force through your feet and your legs. So it's good for stimulating bone deposition.
One of the things I do, Andrew, is jawking. So what that means is I jog down hills and then I walk up hills. So it's jawking.
That's a great example, actually, Janet, because one of the things that I will get patients to do is actually start doing a run-walk routine, okay, which is exactly what you've said.
By sheer coincidence or laziness in my part.
No, laziness. Obviously,
effort.
Intellect, I would say.
Yes. I like to think so. Yes, I like to think so. Yes. Okay. What about swimming? Everybody talks about swimming.
Well, swimming is probably not an exercise that I would recommend necessarily for bone density problems.
No.
Obviously, you're not weight bearing, so you're not getting that impact on your skeletal system. But swimming is an extremely good exercise for cardiovascular fitness. It's a good exercise for general flexibility. Okay, so you can do water-based exercises for flexibility, and water-based exercises are very good for strength as well. So you can do hydro programs, which are actually very useful for increasing muscle strength. Again, I'm not a hydrotherapist, so I can advise on basic hydrotherapy programs. But if there was something more complex and more involved, I would refer that on to somebody with more knowledge than me.
I have to say, having done one aqua aerobics class in my life, no, but I was blown away. Actually, I thought, this is going to be possibly ridiculous. The word ridiculous is in my brain, possibly a little bit that. But I did a 180 degree on that because they have all those groovy little bits of equipment, which mean it is like you're holding weights, like you actually have to, they give resistance and everything. Anyway, it was incredibly hard. The take-home message, it was really hard.
Is that why you only did it once?
Yes, very possibly. Honestly, I failed it. It was very, very hard, and I have extreme respect for it.
Are you treading water at the same time? Because that would be hard.
Actually, no. I think I was standing there and I was but it is very hard. So anyone who's doing it out there, fabulous. Keep going. It was amazing.
So that would combine the bone density and the cardiovascular.
It was kind, but it wasn't kind.
Yeah, right. Apparently not.
So probably what Amelia is talking about there is the buoyancy aids and the floats and the aids that actually allow you to exercise in different planes. Yeah. And you can have different types of resistance when you're pulling your limbs and body through the water.
So it's so clever. Yeah.
It can be very taxing, very hard.
Yeah, right. Even Andrew agrees.
Yeah, it was. It really was.
So we've talked about, cardiovascular and bone density. And when you say vary the exercise, do you suggest sort of doing a combination of those things, even if it goes against the first principle, which is exercise you like?
Well, you can do exercises that you like that can combine those things.
Okay.
So, probably the other categories that I was thinking about that you need to think about are cardiovascular exercise. Things that actually make your heart and your lungs work, so you're getting fitter. And also balance and coordination exercises.
Okay.
So cardiovascular exercises would be accounted for in something like walking or running. You're doing a few things with that. Walking, running will allow you to make yourself fitter and also good for your bone density and good for your endurance. Not necessarily your muscle power, but your endurance. So that's a combination. You're getting a combination effect with that sort of exercise, that sort of activity. I thought balance and coordination. So a couple of things that, again, I recommend and are things that are quite useful for those sorts of issues. It would be something like yoga and Pilates.
Oh, yeah.
Yoga and Pilates are obviously very good for a number of things. Very good for relaxation, particularly yoga. Mm-hmm. They're very good for posture holds. They're very good for balance and coordination. So being able to keep yourself in certain positions, whether they're upper limb posture holds or lower limb posture holds. And Pilates comes in sort of broadly two forms. You can do mat Pilates, which is without the reformer machines, or you could go to a Pilates studio that uses reformer machines where you're getting a bit more resistance and a little bit more probably specific muscle strengthening work with that sort of routine.
Okay, I've never heard of a reformer machine. What does that do?
Well, it looks like it's some form of medieval torture. Seriously, it does.
How did I know you were going to say that?
But actually, reformer Pilates is brilliant, actually. I love it very much. I must show you pictures and things after this.
Oh, okay.
Yeah. It's hard to explain. One of the nice things about it, I think, Andrew, is for people who have health issues, it kind of supports the issue and exercises the rest of you. So it's very supportive as well as, it kind of supports you so you can still do exercise.
Wow.
Yeah.
It allows you to isolate particularly.
Isolate, that's the word that I could have used.
That's impressive. So we've got jogging/walking, we've got swimming, we've got yoga, Pilates. Is there anything else that kind of you recommend?
For strengthening work, I really like a couple of things, and I keep my exercises basic when I'm advising people. I like body-loaded exercise. squats, double leg squats, single leg squats,
Yeah.
lunges, heel raises. You can do upper body exercise like push-ups or
Yeah.
dips, and modified pull-ups or chin-ups. So you don't have to do it against full body weight. You can do it modified. So I like using, I guess, a minimum of external equipment, I think, is good, because I think the more that you bring in external equipment, the more you limit people's ability to actually just do it and go and participate. And it becomes a chore then. It becomes an organisational issue.
Yeah. Plus you have to pay a gym or something.
Well, true. Unless you like actually going to a gym so that you're and having to eyeball someone. The good thing about going to a gym is that there'll be someone there watching you, so you have to kind of attempt
something.
it. Yeah.
Yeah, okay.
I guess a combination of cardiovascular strength and impact work would be something like skipping.
Oh,
Okay.
Okay. Skipping is actually a very useful exercise. But I'd probably say that with a proviso, I'm looking at the age group that we're thinking about here. So 40 plus women have probably, there's going to be quite a representation of that population that have pelvic floor problems.
True. True. Absolutely.
So jumping and impact work comes with some warnings, I guess, about so females that come in who have either stress incontinence or urge incontinence, which is not an uncommon thing after childbirth. So that would be my other big take-home message, is for this age group to actually see somebody that is suitably qualified for.
I know, because otherwise skipping really appeals to me, because
Yeah.
it's like going back to
childhood.
Childhood. Like I want to be able to skip.
Well, I've forgotten how to skip. I mean, I haven't done it for a while. But what about hula hooping, that kind of thing?
Hula hoop, yeah. Well, it's not one that I've recommended, but I'm certainly not averse
Good
to
for the
it.
core.
Yeah.
Good for the core.
Because I remember doing that at
Belly
primary
dance,
school.
isn't it?
So is it a good idea for people to, women 40 plus fabulous, come and see someone like you? Because I guess when you're 20 plus fabulous, you kind of just throw yourself into anything. Oh, you want to play, soccer on the weekends? Yeah, sure, why not? But after a certain age, you should possibly get yourself not obsessed, but assessed.
Assessed. Yes.
Well, you could be obsessed by Andrew. But
Yeah, listen, probably it varies. I mean, I guess I see most of the people that I see are probably people that come in because they've got some musculoskeletal problem or issue. So a lot of people come in with shoulder pain, back pain, neck pain. Part of the consultation is working out what the problem is, what their functional limitations are, what they can't do, and if they are keen exercises, how we have to modify that. So in those cases, I'm obviously advising and modifying what people are doing with their exercise. I think if you're very fresh to exercise, haven't done very much of it, don't really know what you're doing, then it's probably a good idea to go to somebody who is qualified in the exercise space and discuss with them about the best mode of exercise for them. And I guess with that, then unpicking their goals of what they want to do, what they want to achieve with it, and understanding that is probably one of the most important things. Having a thorough health screen as well. So one of the things we do is obviously take a pretty thorough general health assessment. So if there's other things in their history that an issue or worrying, then we'll obviously suggest that they get those attended to or looked at or investigated. Then from there, we can go to whatever program or whatever type of exercise that's going to suit them.
I think having grandkids would be a new form of exercise that a lot of, 50 plus fabulous women have.
Lots of weight.
Yes,
lifting.
weight bearing and the squats you were talking about,
Yeah. It's interesting you say that, Janet. My wife is a physio as well, and one of the things that we always said that we would do when we had young kids was actually write a book about an exercise book about how you can use the kids
Using the children.
Yeah,
Using
just
the
stay
weight for
fit.
children.
Actually, I think that's brilliant. Can you and Lynn all work on that one? Yeah.
It's a good idea. Yeah.
So it's not something that we did. We talked about it a lot when we actually executed it, but I think it'll be quite a good project. I mean, we were considering it for new parents, but maybe it's a good one, Jen, saying for grandparents.
Yes. Maybe you can do, that's right, a little offshoot, like 2 books. I want 2 books now. They can be very short. Like, don't be overwhelmed, Andrew. 2 short books with illustrations.
Yeah.
Excellent.
Yeah, juniors for seniors, something like that. And so, like, on your website, you also say you aim to get me back to my best. But what if my best isn't actually that great? So what do you mean by that?
Getting people back to their best is really relative, I guess. So getting an elite athlete back to their best obviously involves probably a lot more in-depth analysis of what they need to achieve and probably a lot more specific rehab process for things that they need to do. For the general weekend warrior, it's really getting people back to their level of previous functioning. And probably divert a little bit here. I've got a very elderly father who just had a long hospital admission and has come out very deconditioned. So now his aim is to get him back to, he's not going to get back to what he was before hospital, but get him back to as good as we can get him. So I guess it's all relative. It's all really about where people start and what they want to achieve and what we think is actually realistic for them to achieve. So that would be one of the other things is with a middle-aged population that I see a lot of, male and females, sometimes people get very despondent and very disheartened by the fact that now at 50 they can't do what they did at 25. And I think there's got to be a level of acceptance that your body will change.
Which is the psychologist
That's where
role.
That's where you come in.
Yeah.
I'm often negotiating with people about the fact that their goals are good, but realistic goals are probably more important because unrealistic goals just set yourself up for failure. So
You have to temper those goals.
that's probably another sort of diverting back to principles. I know we've gone away from principles, but probably one of my other principles of exercise is be satisfied with whatever you can do. Whatever you can fit in, something is better than nothing.
Yeah.
Actually, I think that's a really big, important point. Something is better than nothing.
Yeah. There's I often go walking down at the beach too. I often sometimes see like someone who's very overweight and they're just doing their best to have a little jog and just move along that path, and I go, good on you. That's
good on you.
that's you're doing something, you're getting out there, you don't care, you're just doing it for you, and this is fantastic.
People don't do that enough, I think.
Yeah. Totally agree. I think you've got to be satisfied with the level that you can function at and be satisfied with if you can only do something once or twice a week because other things get in the way, be satisfied with that. Don't think that if you can't do the ideal program that it's all a waste of time because, again, that sets you up for failure and sets you up for probably not participating in exercise, which is not really what we want to promote.
No, that's right. Something is better than nothing, and you don't have to be perfect, but going out there and doing it even imperfectly will be better.
Give it a red hot crack. That's what I say.
Give it a crack. That's right. I like it.
We also like your emphasis on your website. You talk about hands-on treatment, patient education and self-management strategies.
Yeah.
So why do you think it's important for people to take their treatment plans into their own hands, literally?
Yes. So, I come from an age of manual therapy where handling skills and manual skills were preeminent. So I learned a lot of manual skills and I use a lot of manual therapy and manual skills within my treatment. What I always like to say is that you've got to have good, specific, targeted, high-level manual skills. So you don't do manual hands-on treatment for everything and anything and just do it willy-nilly. You've got to have a reason that you do something and an outcome that you want to achieve. So I think targeted manual therapy is very important, but that needs to be blended in with the patients coming on board and hopefully doing a range of specific exercises that you get them to start with, and then maybe broadening that out as they're getting better, as they're improving, as you can get them to do more, then broadening out their exercise base and then getting them to a point where discharge them and you let them run.
Yeah, seeing a physiotherapist is a very collaborative decision, really. Unless you participate, if you just go in and see a physio and say, fix me, that's really not going to do it all.
It's disappointing. How often do you sort of monitor how people are going? Is that a long-term thing or not necessarily?
Generally, the way that I run it is that I don't have people coming back in for ongoing, routine reassessments or reviews. I'll usually see people for a period of time. They'll usually present to me with some acute problem or subacute problem, which we'll assess and diagnose and work out what the problem is, and then apply whatever treatment we need to apply for it and whatever exercise program we need to get them to do. Once things have largely resolved or fully resolved, then I'll usually discharge them with advice about things that they need to keep on doing, and generally advice about if there's any recurrence and it doesn't get better in several days with a particular management plan, then probably come back and see me at that stage. So that's one of the things with musculoskeletal, more chronic musculoskeletal problems like lower back problems. The most common presentation we get is people who have recurrent episodes, and what we have to do is work out why they're getting the episodes and then work out the best strategy for them to manage it so they reduce the frequency and the intensity of episode.
Yeah. It is interesting that lower back seems to be the main kind of injury or thing that people complain about, isn't it? I wonder why. Why is it the lower back and not the upper back?
I think one of the questions that you had in there, Janet, was about the things that we treat most. My top 5 would be lower backs, then necks, shoulders, hips and knees. So that would be my top 5 of things that I see here.
Yeah.
And then within that, there might be things to do with joints or muscles, or there might be things to do with ligaments or tendons. There's a variety of things that we see.
I admire elite athletes because I think surely every single elite athlete must get injuries. Like it would be almost impossible, is that right, do you think, to perform at an elite level and not at some point get injured in a horrible way?
Yes, they'd all elite athletes, and particularly contact sports athletes, so they'll all be carrying injuries of some sort during the season, all of them. And they just manage it, and physios will manage it. The sports physicians and sports doctors will help them manage it and get through things, and then they might need to go for some sort of investigation or rectification at the end of the season. So, you're very right.
They kind of run headlong into it, though, whereas actually the more average schmo just gets older and more...
injury prone.
Yes, exactly.
More prone to falling off ladders.
Putting up the grissy decorations. Well, Andrew, it's been absolutely fascinating talking to you about, these essential exercises that we need to do as women who are 40 plus fabulous in order to stay fabulous well into our 90s and 100s and onwards. So thank you very much for coming in and talking about all things musculoskeletal and...
Well done.
So good to get that out of the way. And everything else.
Yeah, thank you, Andrew. Thank you very much.
It was lovely to be involved. Thank you.
Gorgi, thanks for listening in today. We hope you enjoyed this ep.
But we'd really love to hear more from you. We'd love to know exactly what you actually think of us and our guests.
So if you're on Spotify, you can rate us. We love stars. And on Apple Pods, write us a little blurb. Let us know what you think, and hopefully we can keep going. Apple loves their algorithms, and we love you. So thanks for listening. We really enjoy your company.
See you next week on She Wasn't Born Yesterday.
Hope 1032. Thanks for listening.